Hello, very good afternoon to those of you in Singapore and that part of the world. A very good morning to others in Europe, where I happen to be sitting at the moment. And of course, a very good evening to colleagues and friends in Australia and beyond. A very warm welcome to our webinar today. I am Professor Nick Sevdalis. And I have the pleasure of being the host and the facilitator of this final event of this year. The webinar is hosted by the Centre for Behavioural and Implementation Science Interventions at the National University of Singapore. We are grateful for all the support of the centre and indeed of the NUS technical and IT teams who have made this event possible for us, indeed the entire series of these webinars for the last couple of years. So it is a great pleasure really to be here with you today to be talking about, as you would have seen in the introductory video, we are talking about sustainable solutions. And people like myself interested in behavioral implementation sciences in the context of healthcare, we increasingly talk about sustainability and taking a sustainability angle in the way that we talk and we plan for healthcare solutions at population level, both for now, but of course for the future. It is not an area I know very much about, and therefore we thought we might as well bring world experts together in this event to talk about it, to hear from them, to try and identify what we actually mean, understand what we mean by healthcare by sustainability and resilience for health and healthcare at population level, but also at healthcare system level, and indeed at the level of individuals. What is it that we need to be looking at and talking about, and how can we use behavioral and implementation sciences? What are the bottlenecks? What are the challenges and opportunities? So today we are talking precisely about that. The title of our event is Challenges and Opportunities of Designing and Implementing Sustainable and Resilient Healthcare Systems. And we have three excellent panelists on our web panel. I will start with Professor Sotiris Vardoulakis and invite him to come on screen. Thank you. We also have from Australia joining us during a rather late hour of his evening. I will then move on to Professor David Pencheon, who's joining us from Scotland during a rather early hour of his morning. So welcome to you too. And last, but of course, by no means least, Associate Professor Jason Lee K. Wee, who's joining us from Singapore in the middle of his afternoon. So this is a truly transcontinental panel that we have set up for ourselves today. I'm forever grateful for all the time that you guys are putting in today, and of course, the preparation and the discussions that we have had so far. Just before we kick off, and I will ask our panelists to introduce themselves and talk a little about their interest and their angle in the field of sustainability and resilience in healthcare and health systems. A couple of things for everyone to note in terms of our housekeeping, how we run these events. The chat function that you're probably all very used to by now in Zoom is disabled for now. However, you probably have noticed at the bottom and towards the left of your screen that there is a Q&A function. Those of you who have attended events on Zoom, you know that this is how we normally take questions and comments. So please, as we go through the panel and our discussion progresses today, please use the Q&A function to submit comments, questions, I will be keeping an eye on facilitating today rather than speaking. I'll be keeping an eye on this, and I will bring these questions into our conversation as the panel goes on. We've got about 55 minutes. We run to the full hour. Towards the end of that hour, we will enable again the chat function for any comments in terms of how the panel went, any suggestions for improvement or anything to that effect. Otherwise, everyone remains muted except our panelists, of course, just to make sure that we can all hear each other. So please do use the Q&A if you have any burning questions at any point. As I said, we'll keep an eye and we'll go through those questions as our conversation sort of evolves over the next few minutes. So without any further delay, I would now like to invite our three panelists to introduce themselves and their sphere of interest in the field. And I will start by Sotiris, and then please, David and Jason, you come in as well to give us your introductions and your interest in sustainability and resilience broadly defined. So Sotiris, we're starting off with you.
Thank you very much, Nick. Welcome everybody to this webinar. It's a pleasure and honor to be part of this distinguished panel. Thank you for inviting me. I'm Sotiris Vardoulakis. I'm Professor of Global Environmental Health at the Australian National University and the Director of the HEAL Network, the Healthy Environments and Lives National Research Network in Australia. And I've had involvement in many international programs and initiatives throughout my career. And before moving to Australia, I was based in England, the UK, for a number of years, working for Public Health England, working closely with David, who's on the panel today. Really humbled to be on the same panel with David, a senior colleague and mentor and leading expert in the field of sustainability in the healthcare sector. And also delighted to be on the same panel with Nick and Jason today. After Public Health England, I spent some time in Scotland, working at the Institute of Occupational Medicine, again, looking at aspects of sustainability in the occupational environment, in the working environment, before moving to Australia, where my work focuses very strongly on sustainability and resilience of health systems, but also of the society to extreme weather, climate change, air pollution, and to other environmental stressors, which can have an impact on infrastructure, on the environment, on human health, and on health services. As part of the HEAL network, we have developed a broad coalition of partners and institutions in Australia and internationally, working on many aspects related to environment, climate change, and health. One of the key themes of this initiative is healthcare resilience and sustainability, looking at the broader aspects of resilience, societal resilience of health services, and also sustainability in the health sector, but more broadly sustainability in our society. I will probably pause here, Nick, if that's all right, and then we
absolutely. This is a great introduction to do, so everybody knows your trajectory and interest. Thank you very much. As I said, we move on to David and then Jason.
Hello, thank you for inviting me, everyone. So my name is David Pencheon. I'm an honorary professor at the University of Exeter in England, and I'm just a regular doctor, but I have spent the last 10 or 12 years overseeing what's possibly the first national unit, research policy and implementation unit, to look specifically at sustainability in healthcare, as Nick described in his introduction. So we learned a huge number of lessons, made quite a few mistakes, but had some notable successes. And my time now is really spent digesting and implementing the lessons of what we did with the help of colleagues right across the system, both public health and healthcare, people like Sotiris, in England since 2008. My particular interest, just briefly, is twofold, really. One is how you make system changes that affect individuals. And secondly, the opposite way round, which is how do you engage and energize and inspire and motivate individuals so they feel part of this journey to what we hope is a safe and resilient and fair future. And that actually starts very often with just how do we talk about this? How do we merge our personal and professional lives? How do we merge our values and our technical skills? And it's a very fascinating, interesting, important issue about how we in this generation at this time do our duty of care if you're a healthcare professional, in terms of making sure we're not just looking after people and populations today, but crucially, we're doing it in a way that doesn't jeopardize, doesn't risk the future welfare, health, fairness, and sustainability of the future. Thanks, Nick.
Thank you, David. And Jason.
Thanks, Nick. Hi, everyone. I'm Jason Lee. I'm based at the Yong Lu Ling School of Medicine at NUS. I'm trained as an exercise and thermal physiologist. My link to the UK is I spent 6 years at Loughborough. Both my honours degree and my PhD was done at Loughborough as a sports scientist. So I have evolved over the years. At present, I deputize the Human Potential and Translational Research Program and also direct a new Heat Resilience and Performance Center. Both of these are based at the school. So with regard to sustainability and resilience, my focus is predominantly at the individual level. So to the end, my main interests are in fluid balance, thermoregulation, and strategies to improve human health and work productivity, especially in a warming world. So in that regard, I look at physiological demands associated with passive and exertional heat stress, and in hope that humans will not just survive, but continue to thrive as we approach, we're in the midst of this climate crisis. So that's it, and thank you once again, for having me. I'm here predominantly to learn from the behavioral strategies, so I have more questions than answers. Thank you.
Thank you, Jason. That's precisely the attitude that I'm here with, and hopefully this will apply to most of our audience as well. I should also say, and it's my turn to say where I'm based. I've got a foot in the south of England. I'm a director of the Centre for Implementation Science at King's College in South London, but I'm also a visiting professor at the National University of Singapore, and I have the pleasure of being the joint academic director of the Centre for Behavioural and Implementation Science interventions there. So clearly my interest is in behaviour and implementation science. I'm a psychologist by training. That probably explains it. And it's someone who's interested in measurement, as most of my colleagues would tell you. The sort of first round of questions really I have for the panel, as I sort of hinted at my introduction today, is to get into some of the definitional elements. What is it that we mean by resilience and sustainability? You've already heard from these introductions that we can look at it at the individual level or we can look at it at the systems level. So I'd like to invite our panel, perhaps we start with Jason, and then we'll move on to perhaps David and Sotiris to offer some definitions of what is it, Jason, in particular, talk about resilience. What is it that we're referring to? And then we move on to sustainability, just so we're clear for our audience what the field that we're really talking about is. And also a comment as to whether it goes beyond healthcare and into health, which is one of the sort of take-home lessons that already took away when we were doing the briefings for this webinar. So Jason.
Yeah, to me, both sustainability and resilience come almost hand in hand. No, I mean, to me, is to effect a system to augment human health while having a lens on the environment, with emphasis not just now, but what is to come. So at the broader or higher level, say for Singapore, I can speak it from my context that the government's commitment for sustainability and initiatives for, say, carbon mitigation, coastal protection, circular economy, food and water security are all quite well spelled out. But maybe I'm biased. No, my question remains: where are the humans in these efforts in terms of their health and well-being? I feel we need to be more explicit in stating and defining how that needle will eventually move with our efforts in sustainability in relation to human health and well-being, and not assume it is all implicit in the earlier efforts or initiatives I mentioned. I mean, in short, we don't want to save the planet and lose the humans. Also, many, if not all, would agree that we must embark on this sustainability or resilience journey, but do we really know how to do it from a system perspective? And therefore, learning from the engineers, they often remind me, you need to think from a system perspective. Although my work is predominantly at the individual level, I think we ought to think how our respective component contributes to the overall system and vice versa. And finally, in terms of sustainability in the context of healthcare or population health, is it a case of lack of good solutions? Or is it more of a case that we are not using them for whatever reasons? And I think that is my impetus again for this dialogue. Maybe the solution is to harness and to tap on behavioral and implementation sciences and know-how. That is my real impetus. I'm sorry, seems like I have more questions than answers.
Listen, I think all this is music to my ears. Obviously, as a psychologist who works in behavior change and implementation sciences, you're hitting the nail on the head. And just a couple of things I'm going to come back to the panel with. Where is the human in all this as individual? What's the interaction between individuals and systems? And do we have an evidence gap? So is that we do not know what the solutions are? Or do we have an implementation gap, which is what we normally look at in our center, which is all about we know what to do, we've got good evidence, but how we translate that evidence into policy and practice. These are two elements that we're going to come back to in a minute. But let me ask Sotiris to comment on the definition of these two areas, and then David to close this first round. Sotiris.
Thanks very much. I very much agree with Jason. I think the dichotomy between resilience and sustainability is somewhat artificial. The classic definition of resilience is the ability to absorb shocks and stresses, environmental extremes, for example. And it's related also to adaptive capacity, which is the capacity to respond to stressors in the environment, for example. When we talk about sustainability, many authors refer to the pillars of sustainability, which are environmental, social, and economic viability, environmental protection, and social ability to create social capital and human capital. In the context of health services, I think when we talk about resilience, most people will perceive that, understand that as resilience, for example, to extreme weather conditions, to heat waves, or to fires, or to air pollution. So this is the resilience of the physical infrastructure, and also the resilience of the staff to this kind of extreme events or disease outbreaks, which can stretch the health services. When we talking about sustainability in the context of the healthcare sector, many colleagues will think about the carbon footprint of the health sector, and also the systems put in place to reduce waste and wasteful practices. In some ways, the same dichotomy of definitions exist in the climate change arena. So many authors will refer to mitigation when we talk about reducing emissions, which is what in the health sector will correspond to sustainability. And the other aspect is adaptation, which is reducing the impacts, which many authors will refer to as resilience in the healthcare services and the healthcare sector. I think these two go hand in hand, and there are many co-benefits when we improve the resilience or sustainability of a system or the healthcare system in a holistic way, in a thoughtful, system-based way. So I will pause here, and obviously happy to elaborate further on.
Thank you, Sotiris. There's certainly this, we're talking about artificial dichotomies and we try to understand the fields a bit better. There's a lot of systems level conversation and also a note here that we're talking way beyond the traditional sort of healthcare remit in a way that we very traditionally in the field of applied behavioral and implementation science we have traditionally thought about. I would suggest so far. But let's come to David for an angle on the same thing. So definition or anything, but where do we elaborate from? Where do we go from where Sotiris and Jason have left us? David.
Yeah, thanks, Nick. Well, I mean, I would agree both with Jason and Sotiris. Those are great definitions. I mean, one of the questions we ought to address in this webinar is what is the role of the healthcare system and healthcare professionals? That's really important. It speaks a little bit to Jason about what is the role of human beings and what we see ourselves as, both as human beings generally, but human beings in a particular role. But let's come back to definitions. I mean, I would echo what I've heard. I mean, sustainability, as far as I'm concerned, and it's a question I get asked a lot, is defining it, is it's really, how do we do our job today, meeting the needs of our patients or our populations or our communities or ourselves, without knowingly screwing up the future? So how do we stop stealing from the future? How do we stop knowingly stealing from the future? And that's incredibly important. And as Sotiris rightly says, we tend to think of it in three pillars around environmental sustainability, but also you need to be careful that a lot of people will see it in terms of financial sustainability. And also in terms of social scientists, we'll look at social sustainability. And it's not as if one is more important than the other. What is crucially important is seeing how they weave together like a plait, and they support each other. And what's really interesting, certainly in my experience, is that it's not true that finance directors will think of financial sustainability and environmentalists will think of environmental sustainability. We can rise above this. And what's really important is to acknowledge people's values in this, and not just our technical skills, and not to stay in our little boxes. One of the greatest things you can do is allow people to give people permission to step outside what they think is their normal role. And this, Nick, is one of the huge challenges for healthcare professionals, because healthcare professionals see themselves as technocrats whose only job is to look after the one patient in front of them at that time. And I know no one would admit to that, but it's incredibly important that we acknowledge that we have a responsibility to both the individual and the wider population at this time, and the wider population in the future. And these are not impossible things to do, because as Sotiris has said, there are many co-benefits to thinking about the future. And finally, the greatest challenge we have, I think, possibly for healthcare systems and healthcare professionals, is that we simply do not do the future. We are creatures of the present. You work in an accident and emergency unit, and you're a crisis junkie with people right in front of you who you don't have time to think, how do I dispose of this needle? Am I using too many drugs? Am I wasting something? It's a really interesting challenge about how we support busy people to actually enact their values in seeing the future as important and not ignoring it at everybody's peril.
Thank you.
And just finally, Nick, I mean, Nick Sotiris quite rightly talked about adaptation and mitigation. People get these very confused. I mean, as far as I'm concerned, adaptation is about managing the unavoidable, and mitigation is about avoiding the unmanageable. That's the really simplest way to remember it. And one is not more important than the other. They absolutely work in tandem. And interventions that do both are the interventions to go for. Interventions that do one at the expense of the other are the ones to avoid.
Well, that's really that's a really useful and it helps memory definitely, David. But I'm sure we're going to come back to this. But there is in the way you're articulating these definitions and what the field should be about. In particular, the example that you gave, sort of, David, about a busy clinician in emergency department and how we support them. So I can say this because I'm a psychologist. I'm slightly, and as you already know, because I've sort of raised this in our briefing for this event, I'm slightly concerned, and I'll tell you why. Because to a psychologist like myself, everything is about individual behavior. So we like to analyze behavior. I like observing people at work. I've spent hours and hours of my professional life observing people in operating theatres, in cancer pathways, in sort of trauma calls, in simulated trauma calls, because this is a safe place to see how people behave, respond, and treat the patient that's right in front of them. So there is a risk. I mean, we set this webinar up as a sort of challenges and opportunities, and I see a challenge. You're talking about the challenges of the field, and I'm seeing a challenge for the behavioral or implementation sciences to over-focus on individuals. And that's my concern. If you tell me to design a study by design, by default, that's how my brain works, and this is how my colleagues' brains work, we will start looking at individual behavior change. Is there a risk there rather than an opportunity that we oversimplify? We look at everything as a matter of behavior change. We therefore put a huge amount of individual onus and responsibility on people rather than systems. Or am I oversimplifying and I'm seeing another dichotomy where one should not exist? So I will start with you, David, and then I'll go to Jason and Sotiris for a comment on this, which is something that's really, I'm finding rather disconcerting as a potential direction in the field. But I hope that you will reassure me that there is a way forward that isn't an oversimplification. David.
Yeah, no, what you raise is really important about, I mean, there is far too much pointing towards the individual about it's about 8 billion individuals acting. And of course it is. No, actions come from nowhere else. But one of the things I think we completely underestimate, and you would know far more as a psychologist, is how much our individual behavior is normed, is made acceptable, is made every day by the behavior of those people around us. So we're not 8 billion individual, autonomous, isolated individuals. We're hugely affected. Even people who believe themselves to be empowered and intelligent and free and liberal, we are unbelievably motivated and normed by what goes on around us. And just briefly, a perfect example of that is in this country, we banned smoking in public, in enclosed public places like cinemas and bars. Months before it happened, it was seen as completely unacceptable. But because of a skillful portrayal of the case, it became completely unacceptable to do the opposite 4 months after the legislation. And no one would light up in a cinema or a pub or a club now. And it shows you that what is seen as highly resistant behaviors can be completely renormed, but by the skill of, I suspect, psychologists and economists and sociologists and politicians and policymakers respecting each other's perspective and skills and making sure that we don't, as academics or policymakers, box ourselves into one particular perspective. And I think that comes down to one of the key skills in this, which is the ability to listen, as Jason said earlier, to listen and question and empathize and learn, not just stand on soapboxes and preach and shout, because it's only through this listening and understanding in mutual cooperation. I mean, any child will tell you that it's not impossible to get to the future. What's very difficult is getting to the future together. Everybody's got their own way of doing it, but listening and empathizing and respecting how different disciplines, as you said, Nick, about psychologists and sociologists and policymakers and behavioral economists, is incredibly important to really switch. I mean, most people know that climate change is dangerous, but like smoking, very few people know exactly how dangerous the trajectory we are on is. And nobody wants to frighten people because it frightens people into inaction and apathy and putting their heads in the ground. So you're absolutely right. There's a really important skill in transdisciplinary research and implementation.
David, thank you. Jason, you work a lot with individuals. Your take on this potential challenge?
Yeah, I think any strategy at the individual or the system level must work first for the individual. Without the basics needs being met, it's very hard. I think it's difficult for a human to think ahead if the current needs are not met. If I use healthcare workers as an example, if the pandemic has taught us how we have overworked them, we know we are overworking them. And at that point of time, there is no need to talk about what is next, because it's all about survival at that point of time. And also, hence, I think we again, learning from the efforts on we should stop putting the secrets. That effort has gone on for decades. It didn't quite work well, because as what David said, it's hard to imagine. Even you know what is to come, you just don't care about it. I said another example for years. Again, the example from my end. We are hoping that Singaporeans would return the tray on their own. And I think there are numerous efforts in hope that we will one day return the trays on our own. But what happened in the end, we know one thing works, that is to fine the Singaporean if they don't return the tray. And that will penalize them, that will cost them, and immediately that strategy work overnight. Whether that is the right way or not, that is open to debate. But that brings across the point what David said. It must mean something to the individual. Hopefully a strategy is one that can tick both boxes and not one or the other. Yeah, so that's my take, in terms of having the priority in any strategies that we roll out towards sustainability, even as one that will take longer term to effect. We must find a creative way to see what it means in the near term. And perhaps in terms of sustainability in the healthcare, there's also scope to reframe it, because I think it gives an impression as if it will cost the system and or the individual level. But maybe if you reframe it, this is an exercise to look through the full process. Maybe there are things you have been doing for years that are redundant. So this is just an exercise, not sustainability. We're just looking at the processes to optimize the workflow. So maybe there's a scope for reframing the same thing in a different language. To tick all the boxes so that humans eventually will act. And I completely agree with David that while it is these 8 billion individuals that will do the actions, there are also scope from a system perspective to enforce it, because sometimes it's beyond what the individual want or doesn't want to do. And it is dependent on the system.
Jason, you're pointing out, this is just a note for me for the next few minutes, this sort of the nature of intervention. If we do intervene, what should those interventions sort of look like, or what's a sort of a good mix of interventions between enforcing and behavior change and everything in between? I'll come back to this in a moment, but let's go to Sotiris first for a comment on my challenge.
Thank you, Nick. I think there is a lot of mileage for behavioral interventions, and that's important for reducing exposures to environmental hazards, for example, extreme heat, air pollution, bushfire smoke, flood events. So the behavioral interventions will protect us, and they can also improve health literacy, can improve awareness of climate change through better communication and awareness-raising campaigns. However, I would argue that we need systems-based interventions, systems change, structural changes to have long-term sustained change in terms of reducing emissions of greenhouse gases, making urban environments more livable. I'll give you a couple of examples from urban health and the urban environments, which is the focus of my work. So obviously, it's important to provide public health messaging around active travel, more walking and cycling, and avoiding using private vehicles for short distances. That obviously this is something that people need to be aware of, that this will improve their physical health, but also reduce emissions of greenhouse gases and reduce emissions of pollutants to the environment. So this is a behavioral intervention, but we need this enabling environment, enabling urban environment to make this happen and make this transition from a car-dependent society to a society which is more physically active and it doesn't depend on motorized transport. And this enabling environment is infrastructure for cycling, infrastructure for walking, safe walking routes, also better green spaces and blue spaces in cities, shaded areas to avoid of exposure to heat and UV radiation. So there are many structural interventions in the urban environment which will facilitate and promote active travel and reduce dependency on motorized vehicles. The same applies to energy, domestic energy, switching from polluting sources of energy to renewable energy. This also requires obviously awareness of the benefits for the environment, for health, for the society, but also requires an enabling legislative and regulatory framework. And this is actually what happened also with the example David put forward around the ban of smoking in pubs and restaurants in many parts of the world. There was an awareness-raising messaging and campaigns, but at the same time was the regulatory environment, regulatory framework put in place to enable this transition to happen. Well, as it happens with many spontaneous changes, they're not sustained, they're not long-lived. I would like to refer also to the reduction in emissions of greenhouse gases during the pandemic. We saw that there was a significant reduction of global emissions of greenhouse gases, around 7% in 2020. But then there was a rebound effect. And this illustrates the fact that if we want to achieve sustained year-on-year reductions in greenhouse gas emissions, we need an enabling regulatory framework. We need structural changes in our economy and society. It cannot happen just spontaneously. It cannot just happen with the behavioral change of individuals.
So that's it's a really nice message, and it's really coherent, coming from your all your three different perspectives. That essentially what I'm hearing here is that we cannot do it alone. So you can't just put the onus on a behavioral scientist to try and design behavioral change interventions. You cannot put the onus on engineers, civil engineers or otherwise, to design more livable, walkable, and so on cities. But you need or lawmakers even, because Jason was alluding to that. You can use regulation and law to sort of mandate essentially human behavior, what it should and shouldn't do. But it sounds like we need all of that in synergy to achieve sustainable change. And if that is the case, and I haven't completely missed the point that anyone can sort of pipe up to answer this, are we getting the balance right at this point in time? Is there, if we need this sort of multi or transdisciplinary approach, are we getting it right? Is the research progressing in a satisfactory direction based on your perspectives, or are we over or under researching or weighing some aspects of what we need to know to achieve better sustainability and more resilience?
I think, Nick, the danger, the imbalance is that there is a quiet conspiracy going on by all those systems which would not want change to put the emphasis on the individual. And I suppose the pinnacle of that would be the example of fossil fuel companies saying this is what individuals can do. I mean, this is a terrible thing that it puts the onus on individuals. And for us as individuals, as 8 billion individuals, we feel completely helpless because, one, we don't always know what the best thing to do is. We know there are lots of things, but we don't know which would have the biggest bang for the biggest buck. And secondly, we're completely disempowered by understanding that our individual effect is almost meaningless. I mean, at times 8 billion, it's not meaningless, but individually, it's pretty homeopathic. Now, what this means is that there's a famous report somewhere called "I Will If You Will," and this is the sort of crux of how do you get individuals to act together. And there's nothing more enabling than to get the "I will act if you will act" together. If, as Sotiris says, there's a regulatory framework. Numerous times I've come across it over the decades, people who I know are reluctant to change. As soon as you say, well, actually, this is now the law, they'll quite happily say, oh, okay, fine, I'll do it. So Sotiris is exactly right. You cannot separate the individual from the collective action. There is a very profound relationship between the two, and you have to respect that relationship, not put yourself in one camp or the other, because that is fatal to put yourself in one camp. The thing to understand is what is it about the system, the wider environment that gets the individual to change, and crucially, what is it about the individual that gets the whole system to change? And that returns us to what I think is an incredibly important point in this webinar, which is what is the role of healthcare systems? Now, healthcare systems are huge. They're in every country, they're in every community, they're run by the most respected people in society. If healthcare professionals and healthcare buildings and healthcare systems are seen not to act, it is one of the most dangerous things we can do. So not only do we need to act in the healthcare system, but we need to be seen to be acting, and we need to be proud to act and tell people that we're acting in this way because climate change is a health issue. We just need to stop talking about it as an environmental issue. Health professionals should talk about it as a health issue, because that's where we have credibility, that's where we have authority, and that's where we have respect.
Thank you, David. That's an angle that I hadn't really considered in terms of what the healthcare system and the sort of the leadership shown and undertaken essentially by healthcare professionals and managers and the system as individuals and the system as a whole is something that we I think is a very useful message coming out of this panel. So, Jason or Sotiris, any further comment on this before I move on to another question about the nature of evidence that we might need?
Can I build on the point David has just made? If the global health sector were a country, it would be the fifth biggest emitter in the globe of greenhouse gas emissions. So it's the impact of the health sector shouldn't be underestimated. It's 7% of total emissions in Australia, 5% in the UK, 10% in the US. It's a very significant sector. It's the biggest employer in many countries. And of course, we need to lead by example, and what we do is very influential across other sectors in the whole society. And it is the case that health professionals have stepped up, and the voice of health professionals it is heard more clearly and more loudly in the climate change debates. It's becoming a realization that climate change is the major public health threat of our century, and of course we need to live up to the challenge and respond to this challenge as a sector, but also working collaboratively across different sectors. Maybe I'll just make one more point about implementation. I think what is absolutely essential is what we are doing, Nick, implementation science, because in many cases we know what the evidence is. We know the scientific evidence about the effects of climate change. We have the scientific evidence about the effectiveness of interventions. But where the bottleneck is at the implementation stage, and many good policies or good interventions are not getting implemented, and this is because of barriers. It can be legislative barriers, or it can be vested interests, a number of barriers which impede implementation, and I think that's why implementation science has is extremely valuable at this stage to make sure that good interventions, good policies are implemented and implement at scale.
No, thank you, Sotiris. You just that would be my next sort of question. But before I get to this, Jason, any comment on this from you, or shall I get into the sort of nature of evidence that we might need? Again, starting from you.
Yeah, no. If I may add, what was just said, more on the behavioral and implementations. I just want to ask, when is that component usually considered? The impression is, let's sort out the efficacy first, the effectiveness, then we talk about how we can implement it. In my practice, I don't see this inclusion of whether, assuming this intervention is effective, it is implementable. And therefore, I need to seek your advice on when, and can it be brought at the earlier parts. So that is, I think that is your next question for us. But if I may just cite an example on how we successfully implemented the use of ice slushy. Now, if you ask what were the enablers, then often I hear a lot about the maybe sustainability or mitigation, but I ask the question back to myself, that is beyond my pay grades, and that's not something I could change. It's almost like that is largely a political call, a government call. And therefore, I ask myself, should I just focus on the adaptation / the resilience part? That is something I could see an immediate change, where the government said that within your own community backyard, you could do something. Although I know if I do it, it won't move the needle much. But at least that is something I could do. And then therefore, if that is true, right, should we stay more focused? What I said that a single strategy should take both boxes, the sustainability and the resilience. In terms of emphasis, is that a way for us to prioritize and say that you don't have to talk about the mitigation because that is beyond your ability to make any changes, and therefore being focused in what you can affect could be an option. Yeah, so maybe I pause here as you lead us into the implementation and behavioral sciences. Yeah.
And thank you for this, Jason. I'll probably take this question to David in a minute, but before I do that, just to sort of supplement what you were saying, and also something that you sort of mentioned to me in the preparation phase for this webinar, it's a sort of question that I sort of was asking us to think about earlier. Is, do we have an evidence or an implementation gap? I mean, going back to Sotiris made the point that we know what the evidence is, and there are evidenced interventions. But in the world that you're in, Jason, in terms of how you manage those individual level interventions, would you say that we have enough evidence and now we need to focus our attention on implementing those, or is this more discovery science that we need to work out, how to develop better resilience and so on? Where would you say the state of science is in your line of work?
In my line of work, I would say the evidence is there, but often things don't get implemented, and I don't know why. Sometimes they say no, because you didn't do a back brief to the chairman to make the decision at that particular forum. You went in sequence. That's one trick. And I come from the defense background as a defense scientist, right? That is this practice, before you go into the boardroom to seek for approval to implement. It's always a good habit. You have coffee chats, you have a back brief to the chairman, because it helps. It's almost like entering into the boardroom knowing that the decision has been made in principle so that it can be minuted down. It sounds a bit weird, but that gives a lot of confidence to the chairman, some background information, because if things presented at the upfront for the first time, right, sometimes lack of the awareness or knowledge could make the decision maker more conservative in not saying yes. So those are some tricks that we learn over the course of our career. But because if I set an example that we implement ice slurry in a local hospital and recently at the construction sites, right, the enablers I could see was, besides the evidence was clear, there was an immediate sensation of a cooling sensation of the ice slurry. So it ticked the box of the recipients can feel the effect now, and therefore it makes a decision much easier. There's not much convincing required, but I can't say the same for other interventions that we're trying to roll out.
So it might be, so that's really interesting, a very useful summary. So you are suggesting that we have enough interventions, but of course then we get into the psychology of introducing those, and you're absolutely right. There's tons of psychological evidence that shows that an immediate effect is something that people value. This is how we're designed as humans, human animals, to sort of respond. If you say to me you're going to do something today and you're going to see the effect in 5 years, that's a very different proposition to saying, can you drink this and then you're immediately going to cool down, then you're going to be better able to continue with whatever it is you're doing. There's a very sort of different behavior change strategy to undertake there. So that's something that we need to bear in mind, and that's a challenge and an opportunity really for us to think about the sort of, it's almost how do we catalog those interventions in terms of how visible, how immediate in terms of the experience, the effects are, definitely for individuals. And you made some really good points in terms of what might be required to persuade decision makers in terms of what is, you mentioned the word conservatism, which is really interesting. So conservatism in decision making, despite perhaps the level of evidence that we might all feel comfortable with, because of perhaps lack of understanding or consideration of what the individual or public reactions might be. So these are points that, in terms of intervention, development, and implementation, they're pretty critical from a design and optimization, intervention optimization or program optimization for implementation might be. But I'll come to David to talk a bit about those issues, not least because, David, you were in a policy implementation unit. So what was the take within the unit of how do you actually address those issues? Because you actually had to not study them, but actually do them. So do you want to share some experience from that work?
Yeah, I mean, it echoes very much what Jason just said, actually, because actually what we did as a unit is ask people for ideas about what could be done at pace and scale. People came up with some great ideas, and to our huge surprise, we found that many of these were going on already. So, for instance, if someone said, well, wouldn't it be great to have a hospital run entirely on renewable energy? And people said, yeah, that would be a great idea. And then lo and behold, someone said, actually, there is one in Northeast England. And you go and look at it and you think, that is really impressive. The technical ability to do that is not difficult. I mean, we know there are lists and lists of interventions that we know perfectly work. The difficulty is not what we do, it's how we do it. And it's that Jason was talking about, that backroom sort of courting and preparation and creating the conditions and making sure all the ducks are lined up. That is unbelievably important. So one of the problems we have, Nick, is that we have these thousands of interventions that are already working on the ground, but they're not working at pace and scale across the system. That's the problem. We put them on pedestals, we give them awards, we point to them from afar, but we do not point to everybody else and say, why do you not do this? I mean, I was part of a system which established a wonderful sustainable food system for a whole county in England, which was stimulated by the hospital buying food. Healthcare system is the biggest buyer of food. Okay, take it to the next county, and they give us every reason why they can't do it. It is extraordinary, and it is something deeply social and psychological about you will never do a change unless you are part of it, unless you feel you're part of the process of the change, unless you feel like your ideas are there, unless you feel you're part of the process. People will never have change imposed on them, except in times of huge crisis like war. In any other time, people need to feel part of it. And it comes back to what Jason was saying about creating those conditions for change such that when the change is introduced, everybody's expecting it, they acknowledge it, it's totally acceptable. So it's this thing about, there are no shortage of interventions. Please do not have any more inventories of how to make a hospital vegetarian. We know how to do this. What we do need is those subtle tips and tricks that Jason was alluding to, that we need to codify and say, this is how we implement change at a large scale with very large numbers of people in, for instance, a healthcare system, which is notoriously tribal, notoriously risk averse, and notoriously conservative, and have got 101 excuses why change shouldn't happen. These are the real skills we need.
So thank you for this, David. I've been keeping an eye on the Q&A as well. David, thank you, because you've taken quite a few of the questions. So I want to bring in one of those questions, then I'll take another one. So Sotiris is coming your way if you have a look at the chat. But David, one of the questions that you sort of started to answer now that's come through the Q&A is why so many projects essentially die a silent death after proof of concept. So you've done the proof of concept, you get those awards that you mentioned, and then no one ever hears anything else about it, and there is no follow-up. Is it a funding issue? Do we reward too many flowers perhaps to bloom? Do we motivate that, but then we don't follow through? In your experience, or should we be doing less but at better and larger scale? Is there a balance to be found there?
Yeah, there's certainly a very unpalatable truth in healthcare that we probably, ironically, do too much healthcare of the wrong thing. So I don't know what the estimates are, but there's probably about 30 to 40% of healthcare is not only completely wasted, but it's probably dangerous as well. The challenge is, of course, we don't know what that 30, 40% is necessarily. But more importantly, Nick, it's very difficult to get people to stop doing things. It's easier to get people to start doing new things. People love novelty and initiatives and innovation. But if you say, look, you've been doing this intervention for 20 years and we've now proved it has very little effect or it's even dangerous, that's a very unpalatable message to give to clinicians who quite rightly have been working in the best possible interest of their patients, only to be told that what they're doing is not the right thing to do, or they should stop doing it. Doing less healthcare is a very unpalatable political and personal message. Do better healthcare is a slightly better message. But to do more healthcare, politicians love and public love more healthcare, and that it's actually not a very good idea to just, because it's very expensive, it's very badly focused on treatment, not prevention. I mean, a tiny proportion of healthcare systems money goes into prevention. And it's about 3% in the UK. It's ridiculous. But we see, we prefer to wait and repair than to stop things happening, because as a public health doctor like Sotiris would tell you, it's very difficult to measure the absence of something through preventing it. It's much better to have a crisis and then rescue the crisis. You get vastly rewarded for that. So the whole dynamics of healthcare delivery rather works against doing less and better. It probably works in the favor of doing more and doing it visibly and doing it on the treatment perspective. I don't know if Sotiris would agree with that.
Well, we'll bring Sotiris in on this, and also Sotiris, I'll take this question that we had in the Q&A in terms of, do we have infrastructure, for example, in hospital wards to enable staff? Because you talked about enablers really nicely earlier. Do we have that within healthcare environments to enable people to change? So a comment on what David just said, and then we'll come back to this healthcare infrastructure. Is it facilitating change or not? Sotiris.
Well, absolutely. What we need to focus on is preventive health and keeping people out of the hospitals, out of the healthcare sector. The system currently rewards activity, healthcare activity. It doesn't reward prevention, and that requires a fundamental change of thinking and ways of rewarding. Reward prevention rather than rewarding health, health and well-being rather than rewarding activity and healthcare utilization. So that this is absolutely fundamental. There are many examples of low-value care which should be and can be eliminated from unnecessary pathology testing, imaging, antibiotic prescriptions. So there's a lot of that, and there is a huge amount of waste in the healthcare sector. There is a lot of work to be done around education and curriculum development and awareness raising within the clinical and medical sector, and also championing good practice and championing and rewarding good practice in terms of high value care, reducing waste, improving the sustainability of the sector. I think there is a lot to be said about bottom-up approaches, which are more effective and more sustainable than top-down hierarchical structures and approaches. I think we need to work with grassroots, with community, societies, doctors, public health professionals, health practitioners, and work bottom up. Sometimes it can take longer, and it's more of an ecological process of building projects and collaborations and partnerships. But I think it's more rewarding, more sustainable in the long run. And this is the approach we're taking, the HEAL network, working with different stakeholders and organizations in Australia to build momentum, to build this movement build this coalition, working towards a more sustainable and healthier environment and society and healthcare system.
Well, it's interesting that, and it's being picked up in the Q&A as we're in the final minute. So I'll ask you in a moment for a sort of 30-second reflection, anything that you would like our audience to walk away with as a message from today. But Healthier Singapore is a great example of a national initiative that it really wants to shift the emphasis onto prevention, and it is what you both described. It's hard because there's no kit involved. It's the sort of longer term behavior change and system support that needs to be in place for all the screening to be done, for all the healthier behaviors to be in place, and support for these behaviors to be in place, and so on. But there are some really global good examples of that. So about 30 seconds to each one of you for any parting shots, anything you'd like our audience to walk away with. I'll start with Sotiris, yourself, and then Jason and David.
I would say that what we need is transformational change, not just incremental change in the healthcare sector and the society more broadly when it comes to improving healthcare and improving, strengthening resilience to climate change and environmental change and reducing the impact of the healthcare sector to the environment. So I think this is the $50 million question, how we instigate this transformative change and how we build the partnerships and coalitions which will put the pressure on decision makers and provide this societal kind of momentum to bring about change.
Thank you.
I don't think there's a silver bullet, but there are some ideas which we discussed today that can help in this direction.
Certainly. Thank you, Sotiris. Jason.
Yeah, my takeaway is this presents an opportunity of a lifetime for us to rethink how we should run the whole society as a whole. Although the focus is on the healthcare, we talk about the components within the healthcare, but this actually means it's beyond the healthcare. We cited the preventive health. You can go all the way upstream. Again, have we impart health literacy as young, when they are in schools? So it goes all the way upstream, because if we don't sort that out, we are just doing damage control. And I think in the way that the crisis is good, I think from human behaviors, if we don't reach this critical threshold, right, I don't think we'll do anything. So I think that is the button, that will give us some urgency and look from the society system perspective and not just within the healthcare.
Thank you very much. Really, really good points here. And David.
Yeah, my take-home message would be very briefly, if you want to do something very practical and you're a healthcare professional, just learn to talk about this as a normal, everyday water cooler conversation, focusing on the health of patients, the health of society, both now and in the future. Learning how to talk about it is one of the most important conditions of change that makes talking about it and action by others much more likely.
Excellent, David. Thank you very much. So again, let me take this opportunity to thank you all for being with us today. I've learned tons in the space of the last hour. We have several questions that are coming in. We could be here for another hour for sure. Thank you very much to the NUS and of course the BISI teams for hosting us and making this webinar possible. We're very much looking forward to seeing all of you in attendance. Thank you all for staying this hour. We will have this webinar series in the future, but we have tons of other events and training in implementation and behavior change methods. So please do join our newsletter, which has been circulated. There's an emailing list that you can be part of. So thank you all very much. Enjoy the rest of your morning. Have a great evening for those of you at the end of your day, and a great rest of your day for those of you in Singapore. Thank you all, and I'll see you in the new year.